Hi, I'm Mackenzie, and this is Dr. Scott Christie, and welcome to another episode of Cheer District's Injury Prevention Series. Today we're going to be talking about jumper's knee and Osgood-Schlatters disease. So, Dr. Scott, can you tell me a little bit more about what exactly jumper's knee is?
Jumper's knee is going to be, and we'll kind of show a picture on here, but it's going to be the tendon that basically runs from the kneecap down to a little bump on the shin. So there'll be a tendon there, and it kind of, all the muscles of the quad come in and go into that tendon. That tendon itself can get damaged. So jumper's knee is damaged to different parts of that tendon. There is a little tendon just above the kneecap as well, so we're not going to get into arguing what's a tendon and what's a ligament. We classify both of these as the tendon. We call it jumper's knee because you see it mostly in activities or sports when you're jumping a lot. And when you jump a lot, it's causing a little bit of damage to the tendons that attach to the quadricep muscles. And as a result, the body has to repair that tendon. But if you end up doing things where there's not enough time between practices or workouts, the tendon will just keep getting worse and worse, and eventually it'll get inflamed and sore. So the idea here is that there's two things that can occur. You can hurt it just by jumping off something high and then a one-time incident where you injure the tendon, but mostly in our sport, we'll see issues with the tendon just because you're doing a lot of activity. As you get closer to competition time, we all know that the routine gets run more often, you do more things at practice, and some of these athletes are still doing things outside of practice. So we call it's basically an overuse injury as far as we're concerned in cheerleading.
So, Dr. Scott, tell me, how can we prevent jumper's knee?
Well, I think our big goal here is to try and strengthen the athletes and make sure that they have good flexibility. So with this type of condition, it's no different. The stronger you make your quad muscles and your hamstrings, the stronger you're going to make the tendons. It just kind of all goes together. So the big important thing is to make sure you're doing your conditioning work outside of your practices so that these tendons get nice and big and thick and strong so that they can handle the actual amount of work that you're doing in your cheerleading practices or your training outside of cheerleading practice. That'll give me one component. The other component is to make sure that you are working both sides of the leg. So you want to make sure you're working the quads, you want to make sure you're working the hamstrings so that there's well balance and you're not getting more pull on one side than the other, because that can also lead to injury. But for me, the big thing with the athletes is to understand, as you're heading close to competition season, we discussed that you start to do more work. So if you are an athlete that is doing other things like tumbling one-on-one sessions or topping classes, basket toss classes, these types of things, as an athlete, as you're getting closer to competition, I would start to take those things out so that you keep your volume still fairly low, and then that way the tendon's not getting overworked. So that would be from the aspect of the athlete. From the coach's standpoint, you have to be aware that the volume is increasing, and you may want to pay attention to keeping an eye on the kids if they're starting to limp or you see them have kinesio tape on the knee. You may have to, as I said, and we've talked about this a little bit before, the coach is coaching the team, but you're also coaching the individual because you can't have a team without the individual. So you need to pay attention to each little thing that's going on with your athletes and address that situation where you might recommend at this point that these kids go see their healthcare practitioner. So we're not going to get into talking about how to actually treat this. You need to go to your local healthcare practitioner and they will help you get through that. The coaches just need to be aware that they are increasing volume, and some athletes don't have the genetics, or they're doing a lot of things outside of practice to be able to handle the volume that's happening.
So now we're going to talk a little bit about Osgood-Schlatters disease. Can you tell us a little bit more about what exactly that is and how it's different than jumper's knee?
So with Osgood, we're looking at, remember we talked about an episode about Sever's disease. Mm-hmm. Osgood is kind of the same thing as that, except it's in a different area. So it's going to be, if you were to reach down on your shin, there's going to be a little bump there. That little bump is where we were talking about the tendon. That tendon attaches. So when you're in younger kids that are like below 16, there's a growth plate there behind that little bump that you feel. So it's very similar to Sever's disease. Okay, so you're getting an irritation to the growth plate, and that's it's pretty sore to touch. So one of the things we test, or if I'm seeing somebody, we have them go down and just kneel on their knees and see if that hurts. And that's going to be one of the checks to see if that hurts. The other one is it will get swollen. So the bump on that knee, it's different than the tendon where you don't necessarily see this. With Osgood, you will see a bump and it'll be red and it'll be sore.
So how does this particular disease happen?
This one's going to be a little bit similar to the jumper's knee, but also different. So you're dealing with athletes that are still growing. That's why you have this condition. A lot of times the bone, and it kind of seems a little bit strange, but the bone will grow faster than the muscles. And so you're dealing with these muscles tugging a lot harder on that growth plate as you go through a growth spurt. So this is going to be one of the reasons why this is going to happen, and it's going to be really important that younger kids are trying to maintain their flexibility and their stretching all the time. So that's going to be one way to try and avoid this. The other thing, which is similar to the actual jumper's knee, is going to be strengthening. So if you can make the growth plate stronger, the tendon stronger, the muscles stronger and well balanced around the whole leg, will also help. But once again, this also comes back to similar to the jumper's knee, where this is an overuse injury. The growth plate can handle being tugged on, but it's going to have a certain threshold where it starts to get injured when you start doing too much volume. So the same thing with the jumper's knee. You just need to be strong, maintain flexibility, make sure your balance is good, but reduce volume of other activities as you start to get closer into competition season.
So the word itself has disease in it. Should we be nervous about that, or why is it that way?
So I'm not actually sure. I'd have to go back and take a look as to why it's called a disease, but there's really no concern. And as we mentioned, same thing with Sever's disease. Osgood, you can train through these things, but ultimately it's going to be up to you and your healthcare provider on how much activity you're doing. They may require you to take complete rest, but you're not. I think the worst thing would be you're probably not going to be a shin model because you're going to have this massive bump on your knee. That's probably the worst thing. So the word disease just makes it sound really scary, and I think it's fun for the kids to go to school and tell people if they have a disease, that's about the only thing that you need to be worried about in that condition.
So to summarize this, what would you tell athletes and parents about both these diseases?
I think in this case, obviously it's really important to be aware of these things. So as a parent, as a coach, and an athlete, as soon as you start to notice these little problems, to get them addressed right away. So go see your healthcare provider. And I think the important part here is we're doing this not because we think you're weak. You're doing this so that you can deal with this injury or this problem right away so that you don't miss practices. And it doesn't turn into a big problem where it can be quite sore, both these conditions. So if we get on top of things right away, it will actually help with long-term practice attendance.
That's it for this week's episode. Next week we'll be talking about the core, in specific, the abdominal area and the lower back.